Deaths caused by COVID-19 in aged care facilities have increased by 40% since May. The Australian reports fatalities have continued to surge after the Albanese government was elected, despite a pledge to fix the crisis. Department of Health data shows an average weekly death rate of 104 people since late May. That's up from a rolling average of 76 since January 1st. Aged care providers are expressing concern over the upwards trajectory of death rates. Let's bring in live now the Australian Medical Association President, Dr. Steve Robson, who's joining us for his first television interview since being elected to the role. So firstly, Steve, congratulations on taking on that new top job at the AMA. I'm sure our viewers will get to know you pretty well over your term over the next couple of years. I am keen to begin with your take on the current COVID situation. How would you characterise the point that we're at in the pandemic, and from a management perspective, is there anything you see that urgently needs to change?
Well, thanks, and good afternoon, Ash. Lovely to talk to you. I'm hopeful, and if we look at the information we have, it looks like we're beginning to come out of that peak of the current wave of COVID, so that's a pleasing thing. Now, one of the issues, of course, is that people who become sick during a wave don't, necessarily recover immediately, and deaths can take a little while to happen. So we may still see some high death rates from people who were infected at the peak of the wave. But I'm hopeful that things will get better over time, and we can bring these numbers down, Ash.
Are you comfortable with the balance the Albanese government has struck since coming into power between not recommending mask mandates, for example, increasing focus on vaccination and antivirals access, which, as we know, had a bit of trouble in terms of kicking off the ground, allowing enough access to people who needed it?
So look, absolutely, any government who comes to power has got a lot on their plate at the moment. And to pick up each of the things that you brought up, we know that the evidence tells us that properly fitted masks reduce the chance that COVID will be transmitted. We know that. Trying to get that out to the community, a government has to strike a balance between mandating things, which I understand is something that political leaders are unwilling to do in many cases, but keeping the population safe. And I'd like to think that our chief health officers, our political leaders can encourage people and let them understand why the advice is being given, and hope that they'll take that advice up. There is a very, very big wave of COVID. I had COVID myself after managing to avoid it for 2.5 years. I recently had it. It's very difficult for people to avoid. I think one of the things that's critically important is making sure that people, have access to and take up boosters. So making sure that those, for example, who need their 4th dose actually are encouraged to go and get that from their general practitioner or wherever they get their boosters from. And also, you're right, now that we know we have the antiviral medications for people who are at very high risk of getting complications and serious disease, making sure that if you get COVID and if you are in one of these groups, you make a beeline for your GP to have that assessment, and if you're eligible for antivirals, a GP can even text a prescription to your nearest pharmacy. I think supplies of the antivirals are beginning to get back onto shelves at pharmacies. So there's lots of things that can be done, Ash.
Steve, I understand you've had a long and varied career. You're a former Navy officer. Today we've seen a preliminary report from the Royal Commission into defence suicides in this country. We are just still working through that report, but essentially there needs to be a complete overhaul in terms of how those claims are processed and the timing of that. There are 13 recommendations the government's getting moving on. There is a real focus on mental health, not only in the veteran space, but also on health workers. I know the NHS is currently looking at this in the UK. Do we face similar challenges here in the Australian medical sector? Do we need an inquiry looking into the mental health challenges in our health workforce? Have we seen this problem really exacerbated by the pandemic?
Yeah, I think everybody in the Australian community has a sense that mental health is a big issue. We see it in our own families, in family members and friends, in our work colleagues, that people are struggling, and I understand that 100%. We're 2.5 years into an incredible pandemic that's put so much strain on the community, and it's had a big toll on Australia's mental health. This has been particularly important for Australians who work in healthcare, because people have been under enormous strain in our healthcare system, and people are working double shifts, working so hard in hospitals. The demands made on healthcare workers are enormous, and I personally am extremely anxious that we pay as much attention as we can to supporting people who work in healthcare in these very, very difficult times, because it is a huge strain on them, and making sure that they're supported, that they have access to help for their own mental health needs is really important. Ash, absolutely right. And as an ex-Australian ADF serving officer, I used to be in the Navy, I also am all for people who've served our country and put on the uniform and done everything they can, getting support as they move through their careers and often make that difficult transition out of a career in the Defence Forces into the community. So there's lots going on in the space, Ash.
Yeah, frontline workers obviously really struggled over the last couple of years dealing with their role. We've seen reports of leave cancelled, extra overtime not being compensated as they would like to be, for example. GPs also struggling. It's been described as having a sort of crisis in our general practice sector in this country. A new survey out today suggesting doctors are increasingly scrapping bulk billing. Is finding a bulk billing doctor harder than ever before?
I think it is very difficult, Ash, and there are lots of reasons for this. I think every Australian understands the enormous pressure that general practitioners have been placed under for the last 2.5 years in the pandemic. They've had not only the burden of responsibility of keeping Australians healthy with all of the conditions like blood pressure and diabetes and all the things we see our doctors about, but on top of that, we've had the additional burden not only of managing people with COVID and often doing it in difficult circumstances with restrictions on seeing sick people and so on, but also managing the vaccination rollout. And the burden that's fallen on the shoulders of Australia's GPs has been enormous. And one of the things that has been a big disappointment for general practitioners has been that the rebates available to their patients, so the money that's paid to their patients through Medicare for consultations, has gone up very, very slowly, and we can see the rate of inflation in Australia is increasing. Doctors and their practices have to pay these costs to employ staff, buy supplies, pay rent, etc. But the rebate available to their patients from the MBS has relatively fallen enormously, and it's making it very difficult in an economic sense to keep practices viable at the moment. So there has to be reform in the way that we rebate patients and pay for the care that general practitioners are providing for Australian patients.
Dr. Steve Robson, no doubt you'll be joining the queue of people lobbying the Treasurer Jim Chalmers ahead of the next budget. We'll be hearing more on that issue, no doubt, as we get closer to that. Really appreciate you joining us here on Newsday. Thanks so much.
It's a pleasure, Ash. Thank you.